The rogue pill. Picture this. A nurse is making her rounds when she notices a patient preparing to swallow a pill they found on the floor. Reddit user Medic Mishap shared this nerve-wracking experience. The patient, thinking it was their medication that had accidentally fallen, was about to take it without any knowledge of what it actually was. The nurse sprang into action, stopping them just in time. It turned out the pill was a part of some misplaced hospital supplies and not intended for patient use at all. This close call highlights the crucial need for vigilance and the potential dangers of taking unidentified substances. Story number 2. The self-diagnosis nightmare. Imagine a patient storming into the clinic, adamant that they have a rare and exotic disease they read about online. Reddit user self-diagnosed Sam recounts a particularly challenging day where a patient, having self-diagnosed themselves with a condition they had no symptoms for, demanded specific, expensive treatments. The nurse had to carefully and diplomatically correct the patient's misconceptions and order proper diagnostic tests. This situation not only tested the nurse's patience but also highlighted the importance of relying on professional medical advice rather than online self-diagnosis. Story number 3. The IV drip fiasco. Now, picture a bustling hospital ward where a rookie nurse is setting up an IV drip. Everything seems to be going smoothly until, without realizing it, she leaves the needle cap on. Reddit user IV Trouble witnessed this alarming mistake firsthand. An experienced nurse quickly noticed the error and corrected it before it could cause any serious complications. This incident underscores the importance of thorough training and double-checking every step in medical procedures to ensure patient safety. Story number 4. The diabetic feast. Imagine a family bringing a mountain of greasy fast food to a patient recovering in the hospital, only to discover the patient is diabetic. Reddit user Foodie Fail shares the story of how a well-meaning family member brought in a feast of burgers and fries to cheer up their loved one. The nurse had to step in and explain the dietary restrictions needed to manage diabetes, all while balancing the patient's emotional needs and the family's good intentions. This tale highlights the challenge of maintaining proper medical care while addressing the emotional support from family. Story number 5. The medication mix-up. Imagine preparing medication for a patient only to realize it was meant for a different route of administration. Reddit user Injection Error describes a tense situation where a nurse almost prepared oral medication for an injection. The nurse's quick thinking and a last-minute verification prevented a potentially dangerous mistake. This story emphasizes the importance of meticulous attention to detail and the role of teamwork in avoiding medical errors. Story number 6. The IV drip smoothie. Ever seen a patient mistake an IV drip for a smoothie? Reddit user Confused Patient shares a humorous tale of a patient who, seeing the clear liquid in their IV bag, thought it was a smoothie and even asked for a straw. The nurse, with a blend of humor and professionalism, clarified the purpose of the IV and reassured the patient. This story highlights how important it is to explain medical procedures clearly to patients and to address their confusion with empathy. Story number 7. The allergy misconception. Picture a patient insisting they're having an allergic reaction to food, only for the nurse to discover it's a reaction to a wool sweater they've never worn before. Reddit user Allergy Alert faced this unusual scenario where a patient's allergy symptoms were actually due to a new sweater rather than their diet. The nurse's ability to identify the real cause and provide relief demonstrates how attention to detail can resolve seemingly complex issues. Story number 8. The oxygen mask mishap. Imagine a patient using an oxygen mask incorrectly by placing it on their forehead instead of over their nose and mouth. Reddit user Oxygen Mix-Up recounts this moment of confusion where the nurse had to gently correct the mask placement to ensure the patient received proper oxygen. This story underscores the importance of clear instructions and proper usage of medical equipment to avoid complications. Story number 9. The call button confusion. Ever had a patient trying to use the call button as a toilet flush? Reddit user Bathroom Blunder shares a funny yet innocent mistake where a patient, unfamiliar with hospital facilities, attempted to use the call button for flushing. The nurse had to step in, show the patient how to use the bathroom properly, and provide a bit of humor to ease their embarrassment. This story highlights how hospital settings can be confusing for patients and the importance of clear, accessible instructions. Story number 10. The DIY bandage blunder. What if a patient used a napkin and tape as a makeshift bandage for a serious wound? Reddit user U.D.Bandage recounts a moment where a patient, trying to handle a deep cut on their own, used non-medical materials to dress the wound. The nurse had to intervene, properly clean and dress the wound, and explain why professional medical supplies are necessary. This story underscores the importance of seeking professional care for serious injuries. Story number 11. The unexpected bed swap. Imagine a patient requesting to swap beds because they believe a different bed will bring them luck. Reddit user Bed swap confusion shares a story where a patient, convinced that a new bed would somehow aid their recovery, insisted on switching. The nurse had to handle the situation with sensitivity, explaining that bed location doesn't affect recovery. The story not only highlights patient superstitions but also the nurse's role in managing patient expectations and providing reassurance. Story number 12. The misplaced prosthetic. Picture this. A patient arrives at the hospital but forgets their prosthetic limb at home, thinking it wasn't crucial for their visit. Reddit user Prosthetic Oops tells the story of how a patient left their prosthetic behind, leading to a scramble to arrange for it to be brought to the hospital. The nurse had to ensure the patient received care while managing the logistics of retrieving the prosthetic. This story highlights the importance of comprehensive patient preparation and coordination. Story number 13. The overzealous hygiene. What if a patient used hand sanitizer as a mouthwash, thinking it was an effective way to freshen up? Reddit user Hygiene Hero recounts a comical yet concerning situation where a patient overused hand sanitizer, leading to a health scare. The nurse had to step in to correct the misunderstanding and ensure the patient received proper care. This story emphasizes the importance of clear instructions on the use of medical and hygiene products. Story number 14. The incorrect dialysis setup. Imagine a dialysis machine set up with incorrect settings because of a rushed technician. Reddit user Dialysis Disaster shares a tense moment when a dialysis machine was improperly set, risking patient safety. The nurse's quick action to correct the settings and ensure proper operation was crucial in preventing a potential crisis. This story showcases the importance of precision in medical procedures and the role of vigilance in patient care. Story number 15. The DIY IV drip. Ever heard of a patient attempting to set up their own IV drip at home? Reddit user Home IV Hero describes a situation where a patient, believing they could handle their own IV, ended up in a mess. The nurse had to address the complications and explain why DIY medical procedures are risky. This story highlights the importance of professional medical care and the dangers of self-treatment. Story number 16. The bizarre prescription mix-up. What if a prescription was mistakenly filled for a completely unrelated condition? Reddit user Prescription mix-up recounts a mix-up where a patient received medication for a different issue than what was intended. The nurse had to resolve the error and ensure the patient received the correct treatment. This story illustrates the importance of accurate prescription management and clear communication in healthcare. Story number 17. The unexpected arrival of a pet. Imagine a patient showing up with their pet, believing it's allowed as a comfort companion. Reddit user Pet Invasion shares a humorous story where a pet was brought into the hospital room, causing a mix-up. The nurse had to handle the situation with care, respecting both the patient's needs and hospital policies. This tale shows how emotional support can lead to unique and sometimes amusing challenges. Story number 18. The DIY medical equipment. What if a patient brought non-medical items from home, thinking they were medical equipment? Reddit user D-Equip describes a situation where a patient used household items as makeshift medical tools. The nurse had to step in to explain why professional medical equipment is necessary and how DIY solutions could lead to complications. This story highlights the importance of using proper medical supplies. Story number 19. The incorrect diagnosis. Imagine a patient being treated for a condition they didn't actually have due to an incorrect diagnosis. Reddit user Diagnosis Error recounts a scenario where a patient was given medication for an ailment they didn't have. The nurse had to quickly correct the diagnosis and ensure the patient received appropriate treatment. This story emphasizes the critical role of accurate diagnosis and the importance of monitoring patient responses. Story number 20. The unusual patient request. Ever had a patient make a bizarre request, like having their hospital food delivered by a specific restaurant? Reddit user Unusual Request shares a story where a patient had an unusual request for their meals. leading to a humorous but challenging situation. The nurse had to manage the request while ensuring the patient's nutritional needs were met. This tale shows the range of patient requests and the creativity required to handle them. And there you have it, 20 unforgettable moments from nurses on Reddit that show the wild and sometimes humorous side of healthcare. From mistaken medications to DIY medical setups, these stories remind us of the importance of proper care and clear communication. Make sure to check out the video to your left, it's packed with even more amazing stories that you won't want to miss. If you enjoyed these tales, be sure to hit that thumbs up, comment with your favorite story, and share this video with your friends. Don't forget to subscribe and ring the bell for more incredible content. Thanks for watching, and I'll see you in the next video.